Sir, you are saying right now AI is just a tool. 5 years or 10 years down the line, if AI becomes more affordable, like a one-time investment, so if couldn't the pathology labs and the radiology centers appoint AI as a diagnostic tool and replace the radiologists and pathologists? They will just they'll do an online work from home type of thing, and they'll be more reliant on this pathology and radiology systems. And the online pathologist and radiologist will just keep a sign instead of using his own brain.
It's not that simple as you think, isn't it? Because as I mentioned in my talk earlier, information governance, patient confidentiality, and who's going to take the ultimate responsibility. I'm sure we have top people from Google. They will be able to throw more light on that aspect because there's a lot of work going on at the moment. Now, for example, if a patient, if the AI misses cancer in a patient, who will be held responsible? Well, the doctor is held responsible. We always get litigations in UK and US. Patients have very low threshold for complaints going to the court for medical legal cases. Now, who's going to be there in front of the coroner? AI? No. And the companies will take care, responsibility, we don't have to find out. Or the institution which buys the software, I'm sure my learned colleagues will be able to answer that question because I'm not qualified enough to answer that. But it's a lovely question. But again, it's a burning question for which we have no answer at the moment unless we get something today from them. Okay, I'll crack on. I will introduce our third panel member. So we have Dr. Hemanth Udayaraju. So he is from Yashoda, Secunderabad, and he's a surgical oncologist, minimal access oncology surgeon, robotic surgeon, so he does everything. So he's like a walking robo. So, so let us ask from him. Probably he's the most evolved person on the stage today. So let's ask. So what do you think, Hemanth?
On a lighter note, I am a prototype who's very difficult to figure out. As a surgeon...
I know you're trying to be too modest, but we won't allow that. Okay.
I'll be very difficult. In the sense, a surgeon will be the most difficult one for an algorithm to crack. Because I understand algorithms work in the way that you ask a specific question, you look at what all answers you get, and then you make a pathway, a flow process. It's very difficult to crack in surgery. So if I may say, I'll be the last one to fall here. But on a serious note, what stays is we have, there's a lot of discussion about jobs getting lost, people getting replaced. I think the right word is not replacement. The right word is redistribution.
Yeah.
So a radiologist who can drive AI, who's empowered by AI, who rises up the ladder to, refine AI. So a job of a radiologist, rather than reading a scan, would be to figure out correct, say that AI, you've gone wrong here.
Yeah.
This is what I would do with my, human interface. Or judgment is something, I think, which is the last thing. If you look at the chain of data, information, knowledge, decision making, the last thing is judgment. Judgment is something which is very human. It's the human element to it. And that will always be our key, and that will be very difficult for any model to crack. Mm-hmm. So I think what we should be worried about here in this entire gamut of changes which are occurring is not our survival. What stays is what makes the patient survive. Right? At the end of the day, if there is any technology, the end user is the patient. In my case, an oncology patient, anything which increases the survival of the patient is going to stay. Anything which is not going to increase the survival of the patient in the long run is not going to stay. It could be you, me, some technology, some instrument.
True.
Right? As a surgeon, what I have seen is I'm still doing surgeries. My seniors here, my colleagues here, the surgeries that we do, the algorithm, if I can say so, for that surgery was established about 50, 100 years ago. In the last 100 years, probably 3, 4, 5, 6 surgeries, probably 10 surgeries have been invented, transplants probably and all those things. But otherwise, the surgical steps remain the same. How we do that, automation has come in. The instruments have changed. A lot of innovation has come in, but the surgical process has not changed. Right? Surgery is safer today because you have safer anesthesia, you have safer equipment. The surgeon is using more armamentarium to make the surgery. So AI is going to be one such tool, I feel. So I don't think we should be overtly worried, but we should be prepared. You know, this is going to be, AI is going to be like, see, we work in teams. Normally a patient sees one surgeon, but I'm nothing without my residents, my assistants, you know, my person who holds my camera.
Yeah.
Sometimes we get the best input from a OT technician. He says, sir, in that particular case, you have done it this way, so probably why don't you try it? So AI is going to be that one smart guy in your OR.
Very true, very true.
Right?
Yeah.
In your OR, in your radiology suite, in your pathology lab, whatever. So that is the role of AI. And we need to be empowered and we need to be, you know, upscaling ourselves. At the end of the day, it is we who run AI. And that, you know, that clarity has to be there within us.
Exactly. I think
that
that's,
approach
that's
as
the
well.
myth we want to break today. So please don't, for those of you, I'm sure most of you are pretty knowledgeable, but for those of you who are still apprehensive, please be reassured that this is going to be an additional tool for us, an assistant. So it's going to help us, definitely. But again, everything takes time. You know, when the electric cars were introduced, there was a lot of, you know, resistance, and finally now it has taken over. So anything new always causes a lot of anxiety and panic. Any questions from the audience? Yes, please.
Hello, sir. This is Dr. Soumya.
A bit louder, please.
I'm Dr. Soumya. I'm doing my MD in hospital administration right now. Recently, I came across an artificial intelligence assisted surgical learning platform. Do you think the budding surgeons and the budding medical students need an artificial intelligence assisted learning to assist them in the process of learning, even from the basics? In the current scenario of Indian medical colleges lacking faculty in a lot of areas, I think that would be the need of the hour too. What do you have to say about it?